Make sure that there it is. And make sure that your microphones are on mute. If you're having any audio issues, please join by phone. And again, be sure to mute your phone. And of course, you can unmute if you have questions or comments during our conversational periods, which there will be a lot of. And if you have not, name and affiliations in the chat, and use the chat for comments and questions throughout our session today. And check your name and add pronouns, and rename if necessary. Next slide, please. We want to take a moment to be intentional in acknowledging that no matter where we sit right now, we are on Indigenous land. For most of us, we are on the grounds of the Yokuts, a tribe who are native to Central California, and the Miwok, a Native group indigenous to what is now known as Northern California. We gratefully acknowledge peoples on whose ancestral homelands we gather, as well as the diverse and vibrant Native communities who make their homes here today. As an organization that centers on social and environmental justice, we feel it is crucial to be informed on the past and ongoing consequences of colonialism. We encourage everyone to learn about the history of these lands and to support Indigenous resistance here and across California. Kings County ACES Network of Care, with funding from ACES Aware, is a collaboration of Kings County Department of Health, California Health Collaborative, Kings Partnership for Prevention, Kings United Way, Adventist Health, ARIA Health, EMT Associates, and Family Health Network. We very much appreciate the work of all our partners to moving this initiative forward to improve the health and well-being of individuals, families, and communities in which we live. Next slide, please. Agenda for today, to start off, we will hold a community-driven discussion on what membership to the Network of Care means and looks like. Next, we will consider trauma-informed strategies and practices and invite our group here to put into practice the development of trauma-informed policies. We will then explore case study involving an employee who put those policies into practice. Finally, we would like to open up the floor, if we are able to, hopefully we'll have time to do this today, to invite our community members to share what they are doing to champion ACEs awareness in their communities. Next slide, please. So during our presentation today, I will be requesting your participation for engagement using Mentimeter. If you are accessing this meeting on your computer, we recommend using your cell phone for active engagement. Please leave the screen open for continuous access. And before we begin our session, we'd like to know, what inspired you to be here and be part of this work? All partners and community attendees are encouraged to participate, and you can log in going to mentimeter.com using the code 72563526. And I believe that the link and code were also shared in the chat. What brings you to the Network of Care today? I see commitment to better serve patients, partnership, delivering quality care, a place to learn and share, collaboration, teamwork in this group. It's what makes it so much fun to come to these events with you guys. So I can better assist the families we work with, partnership, here to learn, collaboration with other grantees, network and collaboration across the valley, and partnership. I'm so glad that we are seeing some of our fellow Valley participants and grantees here. We're here to learn from others That's right. And that's why there's going to be a lot of learning from the community today. We're going to be inviting you guys to share your thoughts and your opinions on quite a lot of things. So get ready to talk, because it's not just going to be me today. Next slide, please. So we'll be engaging, as I said, in some main group activities and small group activities today in an effort to provide opportunities for our community to process and put into practice all that has been learned throughout our previous sessions, as well as to share your experiences and lessons learned. We have heard feedback from many of you about what this membership commitment is. We really value that feedback from both our formal and informal partners to meet our goal of forming a sustainable trauma-informed network of care in the county. With that in mind, we would like to give you all an opportunity to provide us with even more constructive feedback. For this first activity, we will be breaking into small groups and asking you to take a more critical look at our network of care membership. The goal of this activity is to gather feedback that might help us fine-tune the message about this membership and focus our efforts at targeting the appropriate key stakeholders that may have the decision-making power within their organizations to take on this commitment. As we break into our small groups, you will be provided a link to your group's Jamboard. If you haven't used Jamboard before and you're not sure about using this type of platform, don't worry. Our facilitators in each session will be able to provide you with technical support. There are 6 slides on the Jamboard that break down our membership form. Please use the sticky note option to provide feedback, and be sure to list your organization with your feedback. You are also welcome to list your name directly, and that will allow us to follow up with you in case we have questions or would like more feedback from you in the future. Following this activity, we will be returning to our main room here to summarize the community's feedback. And I want to check and see, is Karina here with us today?
Yes, I'm here.
All right, Karina. Karina is going to be one of our group facilitators, as myself and Linda. It looks like we still have people coming into the room. I want to make sure no one's left out. Okay. Yeah, let me just make sure that you are. Okay. All right, folks, let me get our rooms ready here. All right, we're going to go ahead and step into our breakout rooms. And we'll see you there.
Hello, everyone.
Hello.
I should be unmuted now. Hi, Carson. So good to see you in this breakout room with me today. Karina, I would think you're supposed to be in a separate room.
Oops.
Oh no, if she put you group number 2, let me just find a way to maybe join another group. Let's see here. Do you have the link to provide support, Karina?
Which link?
Okay, it's okay. I'll just let me see. There should be a link provided on the slide number for membership forms, but I can also provide support here before I jump off to another room. Does that work for you?
Yeah, I have the Jamboard link. I'm just trying to find it.
Okay. Let me. Sorry, everyone. Thank you so much for your patience as we navigate this technical issue.
It's an involving guardian method. I don't know how they're gonna do. I don't know if we were gonna have them come up with a helper or if we were gonna be able to distribute. Either way, but I wanted to know.
Okay. I think I found it.
All right. Will you be posted in the chat?
Yes, let me get the link really quick.
Okay. I could post.
Okay, here it is.
All right. Wonderful. Hey, I'll be leaving this room to see if there's another room that needs my support.
Yes.
Any more questions, Karina? Or am I good to jump off?
Awesome.
Okay.
Yeah, if you can.
Me or I met. I am the program manager in Kings County Human Services, and I do CalFresh Medi-Cal eligibility.
Hi, everyone. I'm so sorry that we are late to joining this group. We had some technical issues with joining. I'm happy to see that there are some introductions going on in place. I will link into the chat the link we're going to be utilizing to work.
Okay. We were waiting for the Jamboard.
Yes, sorry about that, everyone. All right, if you could all jump into that link, it kind of shows you our current member registration form. And we received multiple feedback from organizations stating that, we're not really sure how to complete this form. We feel that the questions are so direct. So I will share my screen to offer some direction on how to utilize this Jamboard. So as you can see, this offers the background page, which is a definition of what it is to be a network of care member for the Kings County ACEs network of care. So we are seeking feedback from our community to help support the uptake of the membership to the network of care from the clinical and community-based organizations in Kings County. We would also like to get your feedback on, does the synopsis here provided here provide an adequate explanation of what it means to be a member of the network of care? So here we're just simply seeking your feedback. And if you have any feedback on maybe these words are too direct, or this is something that my organization cannot accomplish at this time, you can just simply click on the sticky note, enter a note that says, for example, the introduction is sufficient. You might not feel this way, but this is just my comment. And then you can exit and just leave your note right there. So whatever notes that you have about this first introduction, if you could just please let us know. Does anyone have any understanding or questions about the directions for support? So looking at this first page and reading the introduction to our membership for registration, where it says, by becoming a trauma-informed network of care member, your organization pledges to support towards this effort, which is to serve as a commitment of time and energy dedicated to this work, which will help legitimize both within traditional and non-traditional settings. Please note that becoming a network of care member requires the organization to complete basic tasks that are estimated to take an average of just 5 hours a month. Community members are welcome and encouraged to do more to support the ACEs Aware initiative. Additional activities are not required. And to define the activities that could take 5 hours or less per month, that is simply your attendance to this session each month. That's taking you an hour and a half of your day. So as you can see, that falls into that time. Other time could be you discussing ACEs Aware within your organization and saying, hey, I attended this session, I learned this and that could take, a 15-minute to a 30-minute conversation internally. And other commitments could fall into maybe taking a look at our toolkit. Our toolkit has been provides several incentives that you can be a part of, such as completing the ABC worksheet to integrate your current organizational services into toxic stress mitigation or social services. So those efforts, even reviewing any of the resources that we provide to you, those are hours invested. So we're anticipating that it could take a maximum of 5 hours for that commitment, but that doesn't necessarily mean it will be 5 hours. Does that answer the question for what 5 hours or more could entail? Okay. So with that understanding of the background that I just provided, does anyone feel uneasy about the commitments within this statement? Is there any way that we can refine it to sound a little less complex and so scary?
5 hours sounds scary.
And
Yeah, that's why I asked like maybe an example, because for me, I wanted to present it to other other areas, like for example, for HSA, for the social workers, and that's what they're going to ask me right away. What does that 5 hours encompass? What is it? Is it actually feasible for us? So that's why I said maybe like an example of meetings, communication, networking, just something like that could, for me, easily sell it to them in kind of in a sense.
all right, will do. Thank you so much. And if anything, just because
Thank you,
that
Lynette.
5 hours, like you mentioned, is so scary, it might just not be necessary to even state it because they're already doing the activities if they attend our network of care event. So I really like that you called that out. Thank you. Anyone have any other comments? Are we comfortable to move on to the next page?
I do want to reiterate what Amy said, that I think that I maybe wouldn't quantify, but I would talk about how people can engage, and that can be a little or a lot. And I'll have to tell you, once you get involved in ACEs, it does pull you in. So it's, you just want to engage. I don't think you want to scare them off the bat with 5 hours.
Absolutely. Thank you so much, Nanette. I love that. And I see another question here. Who is a part of the network of care? So we're hoping that with understanding of those, because this network of care membership registration is mostly presented to those who are already within our network of care. So a network of care is a collection of professionals who take care or support children, adults, and families within our communities, and are able to kind of like join into a room to create and support trauma-informed implementation with ACEs screening and training, technically training of each individual, but in the efforts to help treat, heal, and screen for ACEs. So that is the network of care that we all are here together. What additional information so pretty much you would like to see a definition of what is a trauma-informed network of care within this definition? Would it make it too large because the definition is about 8 lines? Would it make the introduction too extensive? What are your thoughts?
I think adding that just enforces the collaboration and the mission and purpose of the work group.
Okay. All right, I love this feedback. Thank you so much, everyone. If it's okay with you with the respect of time, I will move on to the next one, but it does seem like that definition for elaboration and also that time management piece needs to be changed as well. Okay, now for the next part is the next question that comes after our introduction. We do ask the question of what sector describes you and your organization, and if none apply, select other. The sector that we've already derived here is based on the key stakeholder sectors that have been identified from our the network of care roadmap. Who within this room does not know what I mean when I say network of care roadmap? Does everyone know and has access to the network of care roadmap provided by ACEs Aware Initiative? Okay, and everyone has? Okay, awesome. So these are the sectors that we've derived from that. So now we're going to ask you all, does this reflect how you would identify your organization? Does it fall under this, or do you feel like there's still some missing aspects from here? If there are, please include some notes to support us on additional sectors that should be included.
Linda, I forgot how to access the sticky note. Sorry.
Oh, it's okay. You click right here. Can you see this?
Yep,
Click
yep.
right here, and then you can also change pretty colors. I love the color
Okay.
option.
Thank you.
Of course. And while you all work on that section, let me see, I know we have some people in the main room that I would love to add into the breakout rooms. I'm just gonna do that real quick. What
It's
room
not
am I
letting me
in?
access the sticky note.
Okay, hold on.
Same here. Do we have to work on, we can't work on it from your screen. We have to work on it from our own screen or something?
Oh, we have to go to the website.
Oh yeah, you have to go through the link. Oh, were you guys trying to click on my screen?
Yes, yes.
Oh, sorry. Go to the link that I put in the chat.
Linda, you know technology is not my jam.
I'm so sorry. I was over here like, what do you mean? Okay, I'm loving these. Mental health. So would mental health fall under behavioral health providers? Does everyone feel like that needs to be specified further?
So I'm from a mental health agency and we provide behavioral
Mhm.
support services. So that to me is more like a TBS kind of service instead of like a processing mental health one-on-one with the therapist.
Mhm.
So I think the some agencies don't provide the behavioral health, but they provide the one-on-one with the therapist.
Okay, thank you so much. And yes, you can, to answer the question here, yes, you can select more than one. And in regard to the Indian Health Services, would that fall under tribal organizations, or do you feel like it needs to be specified? Because when we start to go into detail about what falls under the tribal services, then we'll have to list like everything, right? So does that sector usually will encompass all of that? Does anyone feel like it should be given into more detail onto what falls under the tribal organizations, or would that suffice?
You know what, and that was my comment, so I think, this is Lali, I think I missed it, sorry, apologize. The font is a little small on my other screen, so I think it would suffice under tribal, because you said earlier, they can choose multiple options, right? So they could do, if they're a medical provider, they can choose option 2, and they can choose the, tribe organization. So I think the options there will probably suffice, so I take that one back.
Okay, sounds good. I really love these, and we'll also be finding ways to encompassate these into the sector. So for the next one, we're going to the third slide now. In the question, does your organization pledge to support this community-wide initiative? To provide some background, we would like to ask you, what does this pledge mean to you when you hear pledging to support the community-wide initiative, which is the ACEs Aware initiative? And the commitment is also defined in our toolkit, which is, we have a snapshot here. It means that a person is committed to ensuring that his or her organization is informed and trained about ACEs Aware and trauma-informed practices, willing to serve as a champion for their organization in applying cultural sensitive trauma-informed approaches, pledging to provide organizational contribution to quality improvement developments towards ACEs in Kings County, dedicated to fulfilling the commitments of care issued by the Kings County ACEs Network of Care. And is there anyone in this room who may have not reviewed our toolkit and the incentivized section? Because this goes into detail for that commitment to care section and the incentivized accessories that we provide to support that. And so with this, after you review the bullet points, if any of this sounds way too heavy for you, or you see any barrier to that pledge, please just tap onto the sticky note and leave a comment. So the yeses are, this seems pretty accurate and straightforward. Is that what I'm hearing? Is that what the yeses mean?
The yeses mean a pledge.
Oh, so everyone's pledging. So the question is not to pledge, because we know, most of us in here already pledge. It's just looking at this form. We're seeking your review. So looking at this form and the commitments for a pledge, is there anything that we need to change to make this pledge more acceptable? Because we are finding that a lot of people are not uptaking this form, and we're wondering, are they scared of doing a pledge? Is it too much of an ask? So if you feel like the commitment for a pledge to support the community-wide initiative, is the language off? Does it need to be more subtle? So people are willing to uptake it? Okay, I see here, apologies, I'm not familiar with the commitment to care. So the commitment to care will be within our toolkit, and the toolkit can be accessed by searching acesawarekings.org. And from there, you can navigate over to the toolkit. And I'll also put that link in the chat also for you all to access. So if you haven't already, please, we encourage that you do review our toolkit. And as you can see here, the commitment to care is followed by the incentivized community action steps. And when you do download the toolkit, you can see that commitment to care page. Pretty much these are things that your organization can accomplish. And when you accomplish that, we give you incentives for it. You're rewarded with gift cards. You're rewarded with self-care tools for your organization and so on. So I'm just going to navigate over to that page to give you all more details.
And I
Here
think that
it
might
is.
be, oh, go ahead.
Oh, I'm sorry. That's all I was going to say. And here it is. And it gives you details of, for example, when you complete our network of care membership form, which we are reviewing with you today, you have the opportunity to get a website shout out, and we'll promote your commitment to care to the community, and the steps go on. And that's the commitment to care.
Linda, can you remind me if we have an option to, if we've made the commitment, is there something that we can put on our own websites that I know when, as a United Way organization, when we have met our standards for United Way Worldwide, we get this little thumbs up thing that we put on our website that we're a member in good standing. Is there something like that we could put on our own websites to show our commitment to this initiative? And I would imagine this is the kind of stuff that needs to go to senior management for approval.
I love that, Nanette. And this is definitely something that we could take back to our leadership to see how it can implement it in our next toolkit. But we are currently offering a decal, but our decal is physical for like physical buildings. But we also understand that, a lot of things are functioning virtually right now. So a website visual would actually be really good. So that's something that we can also consider to support that. I love that idea, Nanette. Very creative. Hey, if it's okay with you all, I'll be moving to the next page. So the next questions we have here is, yes, County ACEs Network of Care can publish. So in support of this publish, just like we mentioned with the pledge, we part of the incentives that we mentioned within that pledge is that we will have a website shout out with your name. In addition to that, we're also creating a community tracker, a sector tracker, which allows us to track how many organizations and how many sectors are represented within the Kings County ACEs Network of Care. So when you do sign up that ability to pledge as part of our support, we're including you in all of our ACEs Aware communication websites. So we're seeking, what are you comfortable with us publishing? Just your organization name? Do you want your contact name represented on that organization as someone to contact for more information? Do you want your email address, your organizational website URL listed? So we're asking, what are you comfortable with us publishing and releasing to the public to let us know this organization or this individual is fully ACEs aware to support this initiative effort? So I would like your feedback on your notes if you feel that this is sufficient or if it needs some more work. If it's sufficient, no need to put a sticky note, but if it needs more work, please feel free to add any comments to support that. So our question here is, do you foresee any barriers with consenting to have your organization's name published in the Network of Care toolkit? And in support of that toolkit, just to show you all, this is the page we're referring to. So right here, we have those sectors that we already provided a visual for you. So if you see, for example, in the behavioral health providers, we have different sectors that fall under that. What we want to do is change this from general sector information to now state specific organizations within Kings County that support those sectors. So for example, if we were to have a CBO general tab, we will have Kings United Way listed instead of general CBO organizational information. So if you're comfortable with your organization being listed within these bullet points, we would like to know what that comfortability would look like. If you have any comments or if you feel like this is something that's doable by organizations, let me know. And if you feel like it's not doable, there might be barriers, let us know as well. Any comments? Do we feel like this page is pretty good? I know this is a lot. I appreciate your patience. Your feedback is highly valuable and super appreciated as well. Okay. However, internal approval may be needed. Thank you so much. Whoever put down this comment, could you please just let me know a little bit more about this internal approval? And is there anything that we can do to make this page easier for internal to say, oh yeah, this is good enough to go? Or is it just, it's going to be complex no matter what? What are your thoughts?
I can speak to this in regards to, like, for example, Anthem, you know, our partnerships and, you know, we're really involved in a lot of things in the community. So anytime another entity is gonna, you know, use our logo or put something up, you know, on our behalf or as part of the partnership or the sponsorship or that collaborative effort, we may need internal approval for that. It's always, I shouldn't say always, but it's almost always, you know, approved, basically. But we would need some sort of approval. And so it just means we have to put that in, we have to plan for it and put that process in place. But not impossible, and it's totally doable.
All right, sounds good. Thank you. And I know we are rushing out here.
All right, thank you guys so much. And I want to hand it over to Linda to share anything that, any information that came from the community with this conversation. Maybe we need to wait a little bit. Is everybody back in our room? Yeah.
All right. I can report out. Thank you so much, Stacy. For group number 3, our group, we discussed the initial title page with the definition for the network of care membership and what it means. They would like to see the definition of a network of care because we are finding that organizations are sending this link out to their partners, and their partners who may not have attended our network of care. This serves as an introduction to them for the very first time. So having a definition of actually what a network of care means will be truly beneficial for that. And also the 5-hour commitment seems a little intense for them. Like, okay, we provided a definition within our network of care sessions that the 5-hour commitment serves as their monthly attendance to this meeting, which, as we know, is an hour and a half, and maybe their communication to their internal organization about what has occurred within the network of care session, and also the addressing of the commitment to care pages within our toolkit. So just maybe removing the 5-hour commitment or elaborating on actually what that means within the definition will be helpful. As we progress through the document with the sector section, they also notified that they would like to see CBO representation listed, as well as mental health. And there was also specific understanding to, can we check multiple boxes? And I assured them that they can. And as we progressed with topics of maybe listing their organizational name in a website or presenting their logo within our toolkit, certain approvals from leadership will be required, but that doesn't necessarily mean it cannot be approved. And that is our report out.
Awesome. Thank you, Linda. And our group had a little bit of a similar feedback there. We discussed our the initial description of the network of care membership, and folks in our group, for the most part, felt that it was an accurate description, but that there may need to be some elaboration, and it sounds like that there's a similar feeling there, perhaps, that we need to elaborate on what a network of care is. And then we didn't really hear a lot of feedback yet about the different sectors. It sounds like what we had listed there, it covers the majority of sectors within the community. And as far as the commitment that's being made, while it aligns up with our mission and values, or it lines up with the mission and values of some of the participants in our group, it may be difficult to do. And that really probably comes down to discussing it with the appropriate leaders in the organization, and making sure that it's understood that organizations can participate in the network of care without organizational contribution as well. And then as far as discussing any barriers as in consenting, a lot of it comes from department heads and needing the right individuals to make those decisions. So it sounds like we got a lot of similar feedback. And I did encourage our group to continue providing that feedback after the fact. We also discussed the possibility of having an individual champion agreement, and there was some a little bit of discussion. We didn't get a chance to finish discussing that, but there was some discussion around that being a good idea, but perhaps we need to elaborate more on what that means. Okay, and I'd like to hand this over to Karina.
So I think it was all pretty much the same, discussing that it would require approval, especially if an organization has multiple departments, that it would have to go through all of those departments to be approved. And then, going through a board process, or, a feasibility assessment was also discussed. So there's just, some organizations have a lot of layers that it would need to go to, and layers also means time, and, just not knowing if how easy it would be to get approval between all of those different entities. We also discussed that first page where, kind of like how Linda was saying, with, saying what those actual commitments are, what it says something about completes basic tasks. So really, what does that actually entail? Is that, this network of care meeting, or is there more to that? And then another thing that we kind of talked about too was with the pledging to be included in the marketing campaign, or even being added into the toolkit, that again, with the approval processes, those organizations might want to see that entire document and really review it before approving to actually commit to be put into it. And so, just having that stuff available so that they have the time to review and are, confident that they do approve the entire document and not just that one page. So those were the main. We weren't able to get to the later pages, so those were our main discussions.
Great. It sounds like there was a lot of feedback going on. I really appreciate all of you for providing your thoughts on that. We definitely are going to be taking all of your feedback into consideration as we move forward and rethink our approach to the membership. And we'd also like to encourage you to review and provide feedback if you can regarding our funding and resources questionnaire. We had distributed that. I believe we distributed it in our May session, and we'll be sharing the link to that in our chat, as well as emails for Linda and myself, in case you want to send us any additional feedback or you want to give us feedback on that funding and resources questionnaire. And with that in mind, just thinking about, are these the resources that we list within that questionnaire, are the supports and resources relevant to your organization? And then I just want to remind you all that we're dedicated to supporting you as you go through the process of becoming a member, or whether you're formally making that happen and you're really committing to all of the steps, or if you're going to do that without that organizational contribution, because we know that the trauma-informed work and addressing ACEs is important no matter what. And please note that you do not have to be a member of the network of care to receive support, but your organization does need to be in Kings County in order for us to provide resources to you. Next slide, please. All right, thank you. As you become a trauma-informed organization or a member of our network of care, integrating your services into the referral platform here in Kings County and serving communities impacted by ACEs, it is important that every individual in your organization understands what it means to be ACEs aware and trauma-informed. Trauma-informed policies can promote engagement in ACEs education and trauma-informed practices to better support individuals identified with an ACE score, or those who are being impacted by other adversities that cause toxic stress. With that in mind, what does trauma-informed policy look like to you? Think of when you hear those words, trauma-informed policy. And I invite you to unmute yourselves and share your thoughts.
Stacey, this is Amy. So Linda and I had met previously just to get a synopsis of how that would look like in my county. And we did bring up trauma-informed training. So to me personally, how I took that was we would, take your trauma-informed training. However, when I presented that, we have other areas that have already had UC Davis trauma-informed training. So that kind of looked like, oh, we've already covered that, even though the gist of your training is a little bit different. So that was something that I came across, that it was your guys' trauma-informed training as opposed to if we offer something else. So that's just my perspective on it.
Stacey, you're on mute.
I just realized as I started talking. Thank you, Linda. I would be interested, Amy, if you'd be willing to share, if you have a link to that information that you can share with us. I would really be interested in learning more about the trauma-informed care that UC Davis is putting out there. What we are providing through ACEs Aware is heavily into the science of adverse childhood experiences. So there may be some differences because it's really focused on that piece, and then talking about trauma-informed care as a response to ACEs and toxic stress. So I'm not certain, since I haven't seen that training, whether they go into the science of ACEs very heavily, but I really would be interested in learning more. There's a lot of resources out there, and the more we learn about those resources, the better. So thank you so much for bringing that up. I appreciate it.
That gives me some context. For example, I work in benefit services. So the training that they get from UC Davis, we feel is sufficient. However, as the social workers in the other side of the building would greatly benefit to have your training as they're working with the kids and the families in a higher, different, more sensitive environment. So of course I feel just as a program manager in benefit division, I did go ahead and look at the UC Davis training, which is a great component because we don't have that high interaction as opposed to the social workers. So in my area, and I don't know if this is other people in their agency have found that maybe some people, are fine with the trauma-informed training that they, routinely get, but the people who have more interaction with the families would benefit more from the training. So it's not going to be straight across the board in my agency per se. Does that make sense?
Yeah, it does for sure. Does anyone else have any feedback regarding that? What do you think of when you hear trauma-informed policy? What do you think that means? What does it mean to have a policy that is trauma-informed? Kind of a big question. Go ahead.
I mean, I think one of the fascinating parts about trauma-informed care is it's scalable. So it can apply in really small ways and really large ways. So within institutions, I think there's ways you can weave it into the policy, even how you can structure things like wellness leave and time off. And then there's ways you can structure it into like staff-client interactions. One thing I'm not sure where this fits in, but one thing I've been feeling a little bit of a call for within trauma-informed care is I feel like there's this acknowledgement that there's trauma is a really pervasive problem and there's a lot of trauma out there, but it rarely actually talks about where the trauma comes from. And I don't know how you could integrate that into policy or like the way we talk about TIC, but I think it would be beneficial to talk a little bit more about the source of some of these.
Absolutely. Thank you. That's a really good point, Luke. And I think that's where the science of ACEs comes into play, because it actually names elements where people experience trauma early in life at critical periods of their development that impact their development and health, right? So that's where the ACEs comes in, and where trauma-informed care is really a response to ACEs, right? So maybe that's where the conversation needs to turn from just talking about trauma-informed policy to maybe ACEs aware and trauma-informed policy, which is what we're going to talk about right now. So I'm really glad you just kind of created a little segue for me. So thank you. When we're considering how to move your organization toward becoming ACEs aware and trauma-informed, there are certain key elements to keep in mind, and you can see them on your screen right now. This is a paradigm shift, you guys. It's moving toward a culture of change from what's wrong with you to what happened to you. And I know for those of you who've joined our sessions before, you've heard those phrases from us a few times. These are policies that shift from judgment and punitive measures toward compassion and transformative practices. Trainings aimed at educating about trauma and secondary traumatic stress can also increase the staff morale, reduce turnover, and allow staff to function at their best. And here are some suggestions for promoting successful trauma-informed services in staff that can be embedded in policies. And you can see them right there, as I said, on the screen. Now, we'd like to showcase a mandated policy that supports the uptake of ACEs-aware training for an entire organization. This policy was developed by Kings United Way, which is one of our leading partners in the Kings County ACEs network of care. We're super proud of them for taking the lead on diving right into this. As mentioned previously, the implementation of such policies supports the preparedness of the organization and its employees to best support individuals in our community who are impacted by ACEs. This policy covers scope, which discusses who the policy applies to and training requirements and the description of the training, policy statement, which provides the why behind the policy, definitions that define key terms within that policy, roles and responsibilities, as in who does this policy extend to and who is responsible for what within this policy, categories of training such as mandatory, role-specific, and new employees, paid time, such as, this training is mandatory, therefore it is considered paid work time, and policy violations where there's a clear statement of expectations regarding the uptake of that policy, and the expectations expressed requiring if anything is to be changed, it requires board approval. So it's a really nice, well laid out policy. And we are going to be looking directly at that policy. But before we do that, I would like to invite Nanette Hilario, who is the executive director of Kings United Way and one of our leading partners in the network of care, to share her experiences with the development and implementation of this organization-wide ACEs and trauma-informed training policy that she was able to put forth in her organization. And she's going to be discussing how this policy was developed and continues to evolve. Thank you so much for joining us, Nanette.
Sure. Thank you so much, Stacy. It's a pleasure to be here. And I'd like to start off by saying that we were invited to join the collaborative or the partnership, the plan and grant for ACEs Aware, to look at an implementation of a closed loop referral system. We have a history of, we operate the countywide 2-on-1 system, and then we also operate the regional homeless management information system. So really we're familiar with data platforms and bringing those type of platforms to fruition. But I thought as I started, first of all, I was getting about 1 million emails about ACEs, and I thought, oh my gosh, this is a big, big deal. So I probably should know more about this than I actually do know. So I completed myself the Becoming ACEs Aware in California training, which is recommended by our Surgeon General, Dr. Nadine Burke-Harris. And once I completed the training, I was so impacted by that training that I immediately felt as though I'll have to tell you, just to back up a little bit, if this training were to come across my desk, I, just as a regular email, a training opportunity, I would have seen it as more of a clinical training or a training for clinicians. I would not have necessarily seen it as a training for community benefit organizations or nonprofits. I am so glad that I took the time to complete the training. It took about 3 hours, 2.5, 3 hours, and it really changed a lot for me, because although the training was done in a clinical setting, really ACEs affects all of us everywhere, all the time. Whether it's my neighbor, my coworker, my friends, my family, ACEs is in our lives. So to think that ACEs is really only about your clientele or your consumers or your patients is really not completely accurate. ACEs affects every aspect of our lives. And it was at that point that I made the decision as the executive director that I was going to recommend, I may have said required, but require all of our staff to complete the training. And they did. And then we had a team meeting, and it became aware at our team meeting that, and I want to offer this up as full disclosure, the ACEs Aware training does have the potential to re-traumatize, and that it brings up a lot of issues. And for some of us who have adult children or children in their teens, a little bit older, after this training, we debriefed in our team meeting, our staff meeting, and I think our sentiment was, oh my gosh, what did I do to my children? Or how have the decisions in my life impacted my family? And then for some of our team members, it was, yeah, this training really helped me better understand some of the trauma I've experienced in my own life or the people in my life, and how that affects the decisions that we make or our health, that impact our health. So I have the capacity as the executive director to require staff training. That wasn't necessarily the issue, but it was important to me. I felt as though the training was so important and so impactful that I wanted it to become policy of our organization. And the only our governing board, which is a nonprofit board of directors, is is the only entity within a nonprofit organization that has governance authority to set policy. And I wanted policy set so that, one, we were making a statement that we are a trauma-informed workplace, that this matters, that this training is important and meaningful. And I guarantee you, if you take this training, it will change how you look at life. And I wanted some teeth to it. I wanted, essentially, policy means that as a condition of employment, you are required to complete this training. We feel as though it is that important. But not only did our board embrace the importance of this training for our team members or our staff, they also said, you know what, we want our consultants to do this too. That if you work with United Way, if you are involved with the work of our community, we want you, we need for you to be trauma informed. So our board went above and beyond what I was recommending. And they have set policy that if you are an employee or a consultant of our organization, you are required to complete this training. And you are also required to complete annual updates. So I think that's a summary of how we got to where we're at. And I can't emphasize enough the importance. If you're not the decision maker in the organization, go to the decision maker, have them come to one of these meetings. If you're with a community benefit or a nonprofit organization, have your executive reach out to me. I would love to speak with them and talk to them about the importance of not just working with our clientele, but also interacting with coworkers and supervisors. And it really infects all aspects of our lives. So
Thank
you
you,
can tell
Nina.
that I'm super passionate.
Yeah, you're
I know
very
that-
passionate. And that's exactly, we're all driven that way. And I think that's why so many people keep returning to our network of care sessions, because they know how important this is. They know it infects all of us. And it is important. It's important implementing trauma-informed services to clients, patients, community members, and it's important for us to understand it as well as staff members, administrators, leaders. So it doesn't really matter where you're at right now, you guys, whether you are identifying a need in your organization or your community, having a conversation with a leader, or being part of the policy drafting process, or even if you're right now implementing policies, no matter where you are in this process, all progress is worthy of acknowledgement and is worthy of your passion. And it's important to continue moving forward with that trauma-informed and ACEs-aware work. So I would like, we're kind of really cutting it close here with the end of our day, and I wanted to make sure that we looked at policy and encourage you guys to think about that more. And I think what we're gonna do, because we had a case study we were gonna look at here, but I think right now let's stick with our conversation about policy and take a look at some principles and frameworks for trauma-informed policy. And this will be a document that's going to be shared with you guys in our resource packet coming to you after this event. So you'll be able to take this to your leaders and talk about it and encourage them to think about this framework as something that can be embedded within even existing policies, or looking at what are we doing right now that's already trauma informed and maybe we didn't realize it. So Linda, would you be able to share that document? Thank you so much. So here is a framework and fundamentals document that really drives us toward ACEs aware and trauma informed work, right? And thinking about this in terms of policy. Many of us here are not policy writers. I'm not a policy writer, but this is something to think about when you're communicating with your leaders, that this all comes from ACEs aware, right? And I can see Linda's going to share this document with you guys in the chat. So first of all, the framework for it Trauma-informed care involves understanding the prevalence, just as Nanette had described, the prevalence of trauma and childhood adversity. It impacts so many of us, and it impacts our health and our behavior. Recognizing the effects of trauma and adversity in our health, our behavior, and applying that recognition to clients and staff and coworkers. Training your leadership, providers, staff, even Annette said her consultants. I mean, everyone needs to be aware of this as we interact with each other. It changes the way we treat each other. It changes the way we respond to behavior. And also integrating that knowledge like you guys are doing now, and avoiding re-traumatization. And that's something that, you know, in our case study, it would come up, and I'm going to be sharing that with you guys through first packet, because I'd encourage you to look at it. It's actually a case study that comes from the ACEs core training, and it's all about a nurse who's experiencing re-traumatization or secondary trauma through the experience of having to do these screenings for the first time with patients. Okay, so this can come up for staff who are doing this work, and how you introduce it plays a big part in whether or not they're going to be successful and comfortable implementing it with clientele. And this moves into those principles, right? ACEs and trauma understanding, getting that training done, safety and stability, making sure that your physical and psychological environment are a safe space for people, whether it's clients, staff, leaders, everyone involved. The cultural humility and responsiveness, and this is something that's becoming more accessible to us as we have more opportunities to learn about implicit bias and other types of issues that come up that cause us to maybe treat each other disrespectfully, and how we can combat those sort of biological responses in our brain of different is something I need to be against. No, that's just something we can stop ourselves from doing and change our perspectives. Compassion and dependability is not just something we give to clientele, it's something we give to ourselves within our working communities, and as well as collaboration and empowerment. That really involves everyone. Everyone should have a voice within the development of or the revision of policy when it comes to this particular topic of trauma-informed. Patients should be able to say, well, this is how I wish that the screening went for me. You know, if it wasn't a good experience, they should be able to give that feedback so that that can be addressed, and so that this can be a positive experience rather than a re-traumatizing one. And of course, promoting resilience and recovery is something that should be done with clients and with staff, right? So it's like the whole organization. It's not just who you're helping, because the helpers are oftentimes, and as we saw, some of you were in our session back in May when we did the screening within our group, and we saw a good majority of people are experiencing 4 or more ACEs in their life. This is something that is very common in the caring profession. Many people who are in the caring profession have high ACEs because they want to help and they want to change the outcome for somebody else. So being cognizant of that and aware of that when you're moving your organizations or encouraging your leaders to move your organization in this direction can really help it be a successful and sustainable process. And you can see below, we have listed a whole bunch of policy resources, lots of articles, even a video on what it means to be trauma-informed, what policies can look like. There's also a whole slew of trainings available through ACEs Aware. That's the very first one, which provides that ACEs core training. And we encourage you, if you haven't taken that yet, please do. Just like Nanette said, even though it is done with a clinical perspective, you will find that it does apply to you. And there's a lot of other trainings there. ACEs Aware also came out with some additional trainings that are perhaps a little more digestible for your community-based organizations, and there's more. So we'll be sharing that with you guys in our resource packet. And I also wanted to take a look at Nanette's policy again, and let's look down at each of those categories and really think about it. I know I've been talking a lot. I feel like a talking head. So does anyone have anything they want to say? Or do you have any response to what we shared just now? Any thoughts?
This is Patty. I want to say thank you to Nanette because for me, I'm trying to get our providers the education that's necessary, et cetera. But Nanette brought something up, and that is the trauma informed care from a staff perspective as well. And with that in mind, we are doing a lot of trauma informed relief for our staff as well. So we are doing it. Maybe they may not get the global picture that we're doing it, but we are doing it. So I want to say thank you, Nanette, for bringing me as more of a researcher, which is more focused on patients, but at the enterprise as well. So thank you.
Thank you, Patty. Like I said, there's so much to learn from the community here that I don't want to be the only one talking, and I appreciate Nanette for sharing. I appreciate you, Patty, for speaking up. I wanted to take a look at that policy statement, and let's think about this. Kings United Way's most valuable resource is its people. Education and training play a key role in clarifying expectations and responsibilities within the organization. This policy sets out, let's go down a little bit. There we go. Thank you. This policy sets out those training responsibilities that are mandatory. Training which must be completed by employees, the employees to whom training applies, the frequency with which training must be undertaken, and the responsibilities of those involved. So it's a very clear, simple statement, right? She goes into more detail within this policy about what that training is. And really they highlighted the ACEs aware training, that core training that we were just talking about. So, it could be something as simple as that of let's start with something, just one thing. Let's start with just that ACEs aware training, right? And maybe we can implement some additional trainings after the fact, once we've got that baseline and we've prepared our organization and our staff for this movement of cutting ACEs in half in one generation. That's a huge goal, to have the education in place, and we need to be emotionally and psychologically prepared to address that, because it does impact us personally as tax clientele. Thank you. And then we can go down a little bit further. She did lay out some definitions here. These are pretty standard definitions when you're thinking about policy definitions. So I don't know that we really need to go over those too much. Can we go farther down? I would encourage maybe even utilizing some of the definitions within those trauma-informed frameworks within the language of a policy that's trauma-informed and ACEs aware. So here's where she broke down those roles and responsibilities. And it looks like everyone's responsible for taking that training. This could look different in every organization. It depends on what the scope of your organization's work and services are and who they interact with, right? So this is not gospel. It's what one organization felt was appropriate and necessary given the scope of their work. So that's something to keep in mind, that everyone's policies are going to be a little bit different or have maybe some different details to them. And especially if we're thinking if you're clinical, you're going to have perhaps more in-depth definitions going on and more in-depth roles and responsibilities. So here are some basic categories of training. She has a mandatory training category where it's across the board, everyone from employee to board member to consultant, right? And then she has role-specific training, which I found that to be really interesting, because you have different people playing different roles in your organizations. So just as, who was it that was bringing it up, that your social workers might need a different level of understanding about this than maybe some other employees, right? So that is where a breakdown of that type would play really well into an organization that might have multiple roles going on. Of course, that new employee orientation. All right. So thank you so much for sharing that screen with us. I'm worried that we're not going to have time to go into this case study, but I do encourage you guys, I'm going to be linking it with the resources that I shared. And again, it is one of the case studies outlined in the core training through ACEs Aware. So you can access it that way. And it actually has more in-depth information than the one that I pulled out. So I encourage you to take that on. There's a whole bunch of different case studies with different ages and different individuals. So you can actually get really different variety of perspectives on how this impacts people. So with that in mind, I also want to just touch quickly on a few things here. And that is, as Nanette had stated it, trauma-informed care. This is something that is important for everyone, right? It applies to all of us, whether it's the people you serve or your employees or leadership. And centering your approach on those impacted by ACEs and trauma is key. And that, as Nanette did a really good job illustrating, that's everyone. You know, it's really taking a universal approach to compassion. Compassion is needed for everyone. And then involving those impacted by ACEs and other adversities that can lead to toxic stress in policy feedback and quality improvement, right? Because if we're serving people and we're doing this, but it's actually hitting them the wrong way, then we're not going to be impactful, and it's actually going to re-traumatize rather than help them heal. So it takes a lot of kind of a feedback loop going on between the client and the server, right? And I saw something in the chat Lupe shared. Let me see. Lupe shared a link in here. Lupe Wang from Calviva, thank you so much for joining us. We have a monthly drop-in series for providers who may experience secondary trauma or compassion fatigue. That is fantastic. Thank you so much for sharing that link. And
I want to be sure folks know it's not just for like public health medical providers, for anyone, all of you who are CBOs, who are providing any type of direct service, we welcome you to join in on that.
That is fantastic, Lupe. Thank you so much for sharing that. As I said before, this community, you guys have input to share that is valuable to everyone. So Lupe, thank you so much for sharing that. All right, so and this is really why training is so important for everyone, right? Because it can affect staff too. And if a staff member is being impacted, they may not be able to provide the care that they need to provide to a patient who's impacted by ACEs or other toxic stress inducing adversities. So we really need to think about putting our oxygen masks on first so that we can have the capacity to care for our communities impacted by ACEs and toxic stress. Assessing your organization's readiness helps to get a baseline measurement for competencies. Even after you commit to this work, regularly assessing your organization can help to identify strengths and areas of improvement. So in your policy activity, well, we didn't really get a chance to do a whole deep activity today, but when you're thinking about policy, and if you get a chance to interact with a leader and you're talking to them about, hey, how important it is to think about implementing a trauma-informed lens when we're thinking about policy. I want to make sure that you know the resources I shared with you will be provided. You can share them with your leaders. And if you are not a leader or an administrator, and I'd like to request that you help us communicate with your leaders because it really is urgent that they understand the impact that ACEs and toxic stress have on the community. So we did take in your feedback earlier today on that network of care membership, and we're so grateful for that feedback. It's going to help us moving forward. And many of you have been attending our network of care sessions each month and advocating for ACEs awareness within your organizations and communities. So you're already champions of this work. In the chat, may you please let us know if you are able to pledge to facilitate connections between the network of care leadership and your organization's leaders and or other community stakeholders that you feel are essential to this work. And with that in mind, I do want to let you know, in the resource packet that I'm going to send out to you guys this week, I'll be providing a soft introduction email template for you if in case you decide that you do want to help us start that conversation with your leaders. And you can utilize that to help us build those relationships, build those bridges so that we can help your organizations move forward. Okay, so as I've said before, really the only way that we can move toward making this work sustainable is to get our administrators and leaders involved and helping them understand the importance of this work. So if you are an administrator, you are welcome to connect with Linda and I. We would be happy to do a one-on-one conversation with you and help you understand how to utilize our toolkit to complete the steps to becoming ACEs aware and trauma informed. Join our referral platform if you are here in Kings County, and complete the community needs assessment form, as well as network with other community organizations, and if applicable, start screening and referring. Okay, well, with that, we'd like to hear from you guys. We'd like to hear what you're currently doing in your organization to support the ACEs movement. So feel free to unmute yourselves if you have any updates to share.
And it could literally be anything from any discussions you've had recently, any developments you've experienced, any trainings you've come across recently. We want to hear it all and find a way to support you as well in your report out. I see, oh, sorry, go ahead, Carson.
I just want to report that we're getting a lot of momentum, I think, going right now. We found a resource of a video to help providers kind of navigate those difficult conversations. I know with our toolkits, we go a lot into the science of it and why it's important, but sometimes it's how to navigate that 2 minutes of conversation with a patient who may have tears in their eyes is something that's very beneficial for our patients. And I want to thank Lupe Wong. I'm actually going to forward that because I know even with, on top of ACEs with COVID, provider burnout is very serious right now. So I thank you for that. That's definitely our resource I want to make available to our providers, because that was something that was missing in our ACEs kind of rollout, is what was the support for our team, because actually right now with the way resources are, we didn't have any resource like this. So this is really great. This is definitely going into our full plan. So thank you.
And Carson, speaking to your maybe more guidance for practitioners, we've also rolled out, and we're going to launch another series, but we rolled out trainings on motivational interviewing, because I believe that is a foundational fundamental that everyone who speaks to anyone should have. And so when we have our new series launch, I will be definitely sharing that with this group. And that's going to be for like a series of live trainings, but we're also going to be rolling out what we're calling micro learnings. So they're going to be more of on demand. And those are going to be really neat because we'll be able to just email it to you, Carson, and then you can just forward it to everybody. And the only thing, they'll have to sign up for like a learning platform. But once they do that, they can access those videos on demand. Because what we're finding is a lot of folks just need to be able to access this when they can get to it, right? Not necessarily at a set schedule. So we're trying to accommodate all these different needs. And so those will be rolling out soon. So I'm going to keep attending these. And as soon as those are available, I'll be sending all those links and probably send it to Linda to send it to everybody. But if not, I'll share it at one of the upcoming meetings.
Yeah, everything you just said, you're speaking our language. I love it.
This is what it's all about, guys, is connecting community, right? And connecting resources from one group to another. I'm loving this. I'm so loving this collaboration that's happening. I do want to remind you guys of the evaluation survey. It really helps us to get that feedback from you guys so that we can enhance what we're providing to you guys each month, make sure that we're really doing justice to this work and really giving you guys the resources that you need through these sessions, that they're really valuable to you. So if you guys can take a moment right now, if you have the time, to just open up that Survey Monkey and go ahead and complete that for us and just let us know how we're doing. Give us feedback if you think anything could be improved or enhanced here. And one thing to keep in mind on number 7, when you're answering what organization hosted this activity, please put Kings County ACEs Network of Care. Thank you guys so much. I know we throw a lot of information your way at these sessions and it could be a lot to digest. I'm so grateful to everyone here today, all the participation that happened. It really is inspiring to me to hear you guys, hear your thoughts, hear your feedback, even if it means that, oh, we have some changes we need to make in how we're communicating things to organizations. That's really good feedback, it's so valuable. So I'm really grateful to all of you guys today for your time and for the efforts that you're already making in the communities that you're serving. And Lupe, thank you so much for sharing these resources with the community as well.
Yes, and feel free to reach out to me. I have a massive email I can send you with lots of different links and resources. So there's my email. Please do not hesitate. It might take me a couple days, but please reach out and I can send you materials we sent to providers on different aspects of the ACEs, like social determinants of health, screening, billing, all that stuff. So I can send that packet to you. And the resource I just put in, it is for members, but I encourage you to check it out. I use it myself. It's My Strength. It's a digital platform. It's behavioral health focused, but it also covers many, many other chronic conditions. And it's a free platform for members. So if you know any of CalViva members, please share that with them. And if you don't have a member ID, then I just encourage you to put 1, 2, 3, 4. You can get right in there. So please, these resources, please feel free to share these. And as I mentioned, if you need any more resources, reach out to me.
Thank you so much. All right. And we do have a raffle question today. So we're going to be going back to our normal raffle prize, which is you can choose an organization to donate to. And we just want to thank you guys again for your participation. Today's question is, can you provide an example of trauma-informed practices that support clients, patients, and/or staff? This could just be one simple practice that you think would be trauma-informed and supportive to any individual you're working with. And you can see that question has been placed in the chat. And you can unmute or you can put your in the chat. And just to be clear, the first person to answer is the winner. Meditation. Teresa is pulling it right out of the 7 stress busters. Way to go, Teresa. Meditation. Yeah. So I don't know how many of you guys utilize those 7 stress busters. I have been actually trying to implement them in my own life, and it can be kind of hard to be consistent about it, but it really is making a difference for me. And I encourage you, for those of you who are providing medical care, to think about that in terms of that buffering resource, those 7 stress busters, and how you can promote that. If you're on the referral exchange, looking at the different organizations on there for those stress busters, or on 211, as they have been drawing that connection to the 7 stress busters. So you can check those things. Thank you, Teresa. And I will be emailing you with details about your raffle choices. Does anyone else have anything to share or any questions before we sign off?
The